What are asthma triggers? Asthma and stress. You know that feeling you get when you're overwhelmed by stress and sense your chest tightening. For asthmatics, that shortness of breath could be the beginning of a full-fledged asthma attack, unless they are able to take a step back and relax. Stress also can cause people who don't have asthma to develop asthma symptoms. Research on the health effects of inner-city conditions found that violent crime is a significant predictor of asthma sensitivity. Alcohol. The reason why alcohol can cause asthma attacks is because it causes acid reflux. Also, the presence of sulfites may also trigger asthma attacks in some people. Drinking certain alcoholic beverages can worsen asthma symptoms and increase your risk of an asthma attack. It seems to occur mainly with wine and beer, not with hard liquor. This has led people to speculate that the reaction, which may include red, itchy eyes, nasal congestion, upset stomach and difficulty breathing, is caused by sulfites in wine and beer, particularly since ethanol in hard liquor has been found to improve asthma by relaxing the airways. Foods. Allergy-causing foods such as cow's milk, soy, wheat, eggs, fish, shrimps, peanuts etc. can trigger asthmatic attack. Also, there are some food preservatives that can cause asthmatic attacks such as potassium bisulfate, sodium bisulfate, potassium metabisulfite, sodium sulfite and sodium metabisulfite. Smoking. Smoking cigarette can cause severe irritation in the lungs. As a result, asthma attack is triggered. Smoking put you more at a risk of developing asthma. According to some recent statistics, 20% of the asthma patients are reported smoking. Food additives and asthma. Chemicals added as preservatives, food colorings, or flavoring agents have been found to cause asthma attacks in some people. These include sodium bisulfite, potassium bisulfite, sodium metabisulfite, potassium metabisulfite, and sodium sulfite. Sulfites are the most common. Some people have trouble with delicatessen meats that are high in nitrates. However, the scientific evidence regarding some of these potential triggers remains in dispute. Traffic-induced asthma. If you're an asthmatic stuck in rush hour traffic, have your inhaler at the ready. Pollutants and fumes belched out by cars can cause you to experience an asthma attack. If you live in an urban area, be sure to check air quality forecasts before heading out on your morning commute. You also might consider asking your employer for a shift that will allow you to avoid rush hour. Airborne irritants. Substances present in the air such as dust, mold, traffic and industrial fumes, animal danger, scented flowers, perfumed cosmetics, etc. can all act as allergens. Respiratory infections. Sometimes viral and bacterial infection in the respiratory tracts such as cold, flu, sinus infections and bronchitis can trigger asthma. In children, it is one of the major triggering factors. Drugs or hormones. There are certain drugs that can cause asthma attacks such as aspirin and anti-inflammatory drugs. Hormones in women. The rise in the levels of progesterone and decline in the levels of estrogen may result in asthmatic attacks. In men, low levels of testosterone can cause asthma to trigger.
AAI Clinics, no excuses, just results. Give us a call for a free consultation with one of our clinical advisors.